ਚੜ੍ਹਦੀ ਕਲਾ ਟਾਈਮ ਟੀਵੀ ਦੇਖ ਰਹੇ ਸਾਰੇ ਦਰਸ਼ਕਾਂ ਦਾ ਵੱਲ ਪੰਜਾਬੀ ਨਿਊਜ਼ ਦੇ ਵਿੱਚ ਸਵਾਗਤ ਹੈ। ਮੈਂ ਤੁਹਾਡੇ ਨਾਲ ਰਿਦਮ। ਖਬਰਾਂ ਦੀ ਸ਼ੁਰੂਆਤ ਕਰਨ ਤੋਂ ਪਹਿਲਾਂ ਇੱਕ ਨਜ਼ਰ ਮਾਰਦੇ ਹਾਂ ਕੁਝ ਖਾਸ ਹੈਡਲਾਈਨਸ। ਪਾਕਿਸਤਾਨ ਦੇ ਪੰਜਾਬ ਸੂਬੇ ਦੇ ਵਿਦਿਆਰਥੀਆਂ ਲਈ ਡਰੈਸ ਕੋਡ ਕੀਤਾ ਗਿਆ ਲਾਗੂ। ਫਿਟ ਜੀਨਸ ਪਾਉਣ ਤੇ ਲਗਾਈ ਗਈ ਪਾਬੰਦੀ। तालिबान का असली चेहरा आया सामने। साबका अफगान फौजी ते तशद्दद करदियां दी वीडियो होई वायरल। अमरीका तो मनभागी खबर, साबका संसद मैंबर हैरी रीड दा होया देहांत। ते हुण खबरां विस्तार नाल। अफगानिस्तान के साबका राष्ट्रपति अशरफ गनी नूं दुनिया के सब तो ज्यादा भ्रिष्ट नेतावां दी सूची विच शामिल किया गया है। ऑर्गेनाइज्ड क्राइम एंड करप्शन रिपोर्टिंग प्रोजेक्टिंग वालों यह रिपोर्ट जारी की गई है। इस विच यह भी कहा गया है कि अशरफ गनी इस उपाधि के हकदार ने। OCCRP दुनिया भर विच स्वतंत्र मीडिया आउटलैट्स लई एक गैर लाभकारी खोजी न्यूज़ रिपोर्टिंग प्लेटफॉर्म है। इस सूची विच बेलारूस के राष्ट्रपति अलेक्जेंडर लुकाशेंको नूं भी पहला स्थान दिता गया है। इस तो इलावा सीरिया के राष्ट्रपति बशर अल असद, तुर्की के रेसिप तैयब अते आस्ट्रेलिया के साबका चांसलर सेबेस्टियन कुर्ज भी भ्रिष्ट लोगों की सूची में शामिल ने। OCCRP ने भी कहा है कि गनी इस उपाधि के हकदार ने क्योंकि उन्होंने अपने लोगों को डूंगे संकट में छड्ड दिता सी। पाकिस्तान के पंजाब सूबे में एक यूनीवर्सिटी के पुरुष और महिला विद्यार्थियों लिए ड्रैस कोड लागू किया गया है। यह आदेश देश के फैडरल डायरैक्टोरेट ऑफ एजुकेशन द्वारा इस संबंध में एक निर्देश जारी किए जाने के महीने बाद आया है। डेली पाकिस्तान मीडिया मुताबिक नवे नोटिफिकेशन के तहत पुरुष विद्यार्थियों को शॉर्ट्स, कट ऑफ जीन्स, मल्टी पॉकेट फटे या तंग जीन्स और पैंट, कुछ भी लिखा होया टी शर्ट पाने की इजाजत नहीं है। सोशल मीडिया ते इन्नी दिनी तालिबान की एक वीडियो वायरल हो रही है जिस विच तालिबान एक साबका अफगान फौजी अधिकारी ते तशद्दद करते नजर आ रहे हैं। मीडिया तो मिली जानकारी अनुसार इस वायरल वीडियो नूं देखण तो बाद वड्डी संख्या विच लोग सोशल मीडिया ते इस काम नूं सत्ता विच आउण दे बाद तालिबान दे पहले कीते गए अपने कामां लई मंगी गई आम मुआफी दे उल्ट दस्सिया जा रहा है। अमरीका के साबका संसद मैंबर ते नवाडा तो सब तो लंबे समय तक कांग्रेस के मैंबर रहे हैरी रीड का देहांत हो गया। वह 82 साल के सन। साबका संसद की पत्नी लैंडरा रीड ने एक बयान च कहा कि हैरी ने मंगलवार को आखिरी साह लिया। उस समय परिवार के सारे मैंबर मौजूद सन। वो पिछले 4 सालों तो पैनक्रियाटिक कैंसर तो पीड़ित सन। उधर तालिबान ने औरतों को बिना हिजाब के दिखाने वाले टीवी सीरीज नूं प्रसारित करने ते पाबंदी लगा दी है। मीडिया रिपोर्ट मुताबिक तालिबान के सभ्याचारक कमीशन ने नवे जमाने के कपड़ियां नूं दर्शाउण वाले इश्तिहारां ते भी पाबंदी लगा दी है। देश विच अफगान सभ्याचार ते सरिया कानून के विरुद्ध विदेशी टीवी सीरीज के प्रसारण ते अजिहे गहनिਆਂ ते प्रसारण ते पाबंदी है। अफगानिस्तान विच विदेशी मीडिया प्रसारण सारे नियमां नूं मनण लई पाबंद है। उधर मैनीटोबा की प्रीमियर हीथर स्टीफन्स ने कोविड-19 के केसां की वध रही गिनती प्रति सूबे की प्रतिक्रिया बारे एक अपडेट प्रदान की है। स्टीफन्स का कहना है कि हेक होम रैपिड टेस्ट किटां टेस्टिंग साइटां के नाल बाल ते परिवारिक सेवावां केंद्रां ते उपलब्ध करवाईयां जाणगियां। इस दौरान उन्हां वल्लों नवीं पाबंदियां की घोषणा भी की गई है जो 28 दिसंबर तो लागू हो चुकी है।
As with many jurisdictions in Canada and to the south of us, case counts are rising rapidly, and we must do everything we can to ensure our healthcare system can continue to offer patients the care they need when they need it. As those case counts continue to rise, so does the demand for testing at sites across the province. As a government, we continue to explore options to increase our capacity and alleviate wait times for those seeking a test. Starting today, take-home self-administered rapid tests will be available at provincial testing sites as well as at other locations to help protect vulnerable Manitobans. When an individual visits a testing site, the type of test they receive will now be based on their vaccination status. These changes are being introduced incrementally and will help manage current and growing demand for COVID-19 tests. Additionally, rapid test kits will soon be available at Manitoba Family Services offices, through child and family services agencies, as well as community living and disability services clients living independently. Manitobans are seeking a COVID-19 test for out-of-province travel purposes should not attend provincial testing sites. Rather, they should seek out a private provider. Our number one priority is to protect the health and well-being of all Manitobans. We continue to have some of the most stringent public health measures in the country to minimize the spread of this virus and protect our most vulnerable.
As we forecasted last week, we're seeing increased daily COVID-19 numbers. Since Friday, we've reported 2,154 positive cases. These increased case counts means we are seeing an increase in demand for testing, and that increase in demand is resulting in increased wait times, both to receive the test but also to receive the test results. And so as that demand has increased, we've also seen now this backlog of tests. So we already have orders in place that reduce capacity for private gatherings. Those have been in place for quite some time now in Manitoba. We're introducing new public health orders that affect the size of gatherings in public places. So effective tomorrow, we're reducing gathering sizes in public places for groups of vaccinated people. So gatherings must not exceed 50% capacity of the usual capacity of space, or now capped at 250 persons, whichever is less. So these capacity restrictions will affect restaurants, licensed premises, food courts, socials, movie theaters, concert halls, performing arts venues, outdoor ticketed performing arts events, museums, art galleries, outdoor and indoor sporting and recreational facilities, including dance studios and martial arts studios, gyms, fitness centers, and yoga studios, indoor and outdoor ticketed sporting events, indoor recreational businesses, seasonal facilities and events, religious services and Indigenous cultural events, bingos, casinos, businesses, and VLTs. So these restrictions place capacity limits at these locations, including gatherings where all attendees are fully vaccinated.
ਅਮਰੀਕਾ ਦੇ ਚੋਟੀ ਦੇ ਮਾਹਰ ਡਾਕਟਰ ਐਂਥਨੀ ਫੌਚੀ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਅਮਰੀਕਾ ਨੂੰ ਘਰੇਲੂ ਉਡਾਨਾਂ ਦੇ ਯਾਤਰੀਆਂ ਲਈ ਵੀ ਟੀਕਾਕਰਨ ਨੂੰ ਲਾਜ਼ਮੀ ਬਣਾਉਣ ਤੇ ਵਿਚਾਰ ਕਰਨਾ ਚਾਹੀਦਾ ਹੈ। ਯੂਐਸ ਦੇ ਰਾਸ਼ਟਰਪਤੀ ਜੋ ਬਾਈਡਨ ਦੇ ਚੋਟੀ ਦੇ ਡਾਕਟਰੀ ਸਲਾਹਕਾਰ ਫੌਚੀ ਨੇ ਇਹ ਵੀ ਕਿਹਾ ਹੈ ਕਿ ਅਜਿਹਾ ਆਦੇਸ਼ ਦੇਸ਼ ਦੀ ਪਟੜੀ ਟੀਕਾਕਰਨ ਦਰ ਨੂੰ ਵਧਾ ਸਕਦਾ ਹੈ। ਨਾਲ ਹੀ ਇਸ ਨਾਲ ਉਡਾਨ ਦੌਰਾਨ ਸੁਰੱਖਿਆ ਵੀ ਵਧੇਗੀ। ਵਰਤਮਾਨ ਵਿੱਚ ਸੰਘੀ ਨਿਯਮਾਂ ਵਿੱਚ 2 ਸਾਲ ਤੇ ਇਸ ਤੋਂ ਵੱਧ ਉਮਰ ਦੇ ਹਰੇਕ ਵਿਅਕਤੀ ਨੂੰ ਮਾਸਕ ਪਾਉਣ ਦੀ ਲੋੜ ਹੈ। ਫੌਚੀ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਜਦੋਂ ਤੁਸੀਂ ਟੀਕਾਕਰਨ ਨੂੰ ਲਾਜ਼ਮੀ ਬਣਾਉਂਦੇ ਹੋ ਤਾਂ ਇਹ ਵਧੇਰੇ ਲੋਕਾਂ ਨੂੰ ਟੀਕਾਕਰਨ ਲਈ ਵੀ ਉਤਸ਼ਾਹਿਤ ਕਰਦਾ ਹੈ।
Well, I think it's a confluence of issues, Joe. It's not going to be one unidimensional issue. First of all, there are a lot of people that are vaccinated in this country. Number one, 60+% of the population is completely vaccinated. A number of people have already been infected. So either there's underlying immunity, which I think is absolutely the case. We're seeing a lot of that in South Africa, and or there's an inherent limitation and lowering of the virulence of the virus itself. We don't know what contribution each of that is making. I believe, and most of my colleagues believe, that a lot of it is due to the prior immunologic experience you've had with the virus, either because you've been vaccinated, number one, you've been boosted, and a number of people have actually gotten infection and recovered. The group that we're really concerned about, Joe, are the unvaccinated people, because even if this virus is inherently less severe, just the volume of the numbers of cases that we're going to have could actually put a stress on the hospital system. You know, if you have 50 people who get infected and 5 of them are winding up getting seriously ill, and then you have a lowering of that percentage, but you have 1,000 people getting infected, you're still going to have quantitatively more people going to the hospital. So that's what we're concerned about, particularly among the unvaccinated. You know, I'm not going to tell you that for the simple reason is that I don't want to be publicly telling what I'm recommending to the president, because if then the president doesn't do it, I don't want to make it look he's going against it. The president takes all recommendations, all discussions, and as a group we make a decision about what's best to do. There are pros and cons to that. I mean, you've got to ask yourself why it is you're making that requirement. If you're making a requirement for vaccination for people to get on planes who are coming into the country, that's understandable. You don't want to bring more cases into the country. But if you're talking about requiring vaccination to get on a plane domestically, that is just another one of the requirements that I think is reasonable to consider. And I think that's what you're talking about when you heard me make a comment. You know, there's requirements that you might want to get if you want to get into college, or you want to go to a university, or you want to work in certain places. When you make vaccination a requirement, that's another incentive to get more people vaccinated. If you want to do that with domestic flights, I think that's something that seriously should be considered. Omicron is different. As you just heard from Dr. Jha, it has an extraordinary capability of transmitting very efficiently from person to person, which is the challenging part of it. The part that might be actually a silver lining, possibly, you don't want to get too overly optimistic about it, but it appears, at least from what we're seeing in our colleagues in South Africa, that the severity of the disease is less. So that could be due to the fact that there are so many people in South Africa who actually have previous infections with Delta and with Beta, that they have that underlying residual cross-reacting immunity that's not protecting them from getting infected, but it's protecting them from getting seriously ill. We're starting to see a bit of that in the UK, and we're seeing it even now in our own country. So it very well may be that focusing on hospitalizations as the parameter that you really want to follow, and if they stay low and do not go back up, but we're not there yet. We're still getting increases in hospitalizations, so we better be careful we don't jump the gun and think that we're in good shape when we really still need to be extremely careful getting people vaccinated, getting people boosted, making sure we wear masks. We're in a tough situation with Omicron. It's not something to be taken lightly.
ਮਾਹਰਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਸ਼ੁਰੂਆਤੀ ਖੋਜਾਂ ਤੋਂ ਪਤਾ ਚੱਲਦਾ ਹੈ ਕਿ ਓਮਿਕਰੋਨ ਦੇ ਕੋਰੋਨਾ ਵਾਇਰਸ ਦੇ ਪਹਿਲੇ ਰੂਪਾਂ ਨਾਲੋਂ ਹਲਕੇ ਲੱਛਣ ਨੇ, ਪਰ ਵੱਡੀ ਗਿਣਤੀ ਵਿੱਚ ਲੋਕ ਸੰਕਰਮਿਤ ਹੋ ਰਹੇ ਨੇ। ਉਹਨਾਂ ਨੇ ਵੀ ਕਿਹਾ ਹੈ ਕਿ ਇਹ ਸਾਰੇ ਮਾਮਲੇ ਗੰਭੀਰ ਨਹੀਂ ਨੇ ਅਤੇ ਬਹੁਤ ਸਾਰੇ ਮਰੀਜ਼ਾਂ ਵਿੱਚ ਲੱਛਣ ਬਹੁਤ ਹਲਕੇ ਨੇ। ਕੈਨੇਡਾ ਦੀ ਸਿਹਤ ਮਾਹਰ ਡਾਕਟਰ ਮਾਰਥਾ ਫੁਲਫੋਰਡ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਇਹ ਸਮਾਂ ਹੈ ਕਿ ਇਸ ਗੱਲ ਤੇ ਧਿਆਨ ਕੇਂਦਰਿਤ ਕੀਤਾ ਜਾਵੇ ਕਿ ਕਿੰਨੇ ਲੋਕ ਕੋਵਿਡ-19 ਨਾਲ ਬਿਮਾਰ ਹੋਣ ਕਰਕੇ ਹਸਪਤਾਲ ਵਿੱਚ ਦਾਖਲ ਹੋ ਰਹੇ ਨੇ।
Yeah, I think we have different narratives in terms of whether we need to worry about this or not. A lot of the people who are testing positive, of course, are not sick. And this is an incredibly important message to get through. What we have right now is a very high number of positive PCR tests, but the hospitalization rate actually is fairly flat, as is our ICU rate. And again, it's what the expectations are. And so I think for the province, one of the things we need to start reporting really accurately is whether or not people are being admitted because of COVID or just with a positive test, because of course everybody gets screened. Anybody with screen positive is reported as an admission. And we also have to be very realistic. It's never going to be zero. It's respiratory tract season. And so for me, it's always been that balanced approach. I'm actually a lot less worried about cases in the community who are not actually unwell, and saying we've actually achieved what we needed to achieve in terms of dramatically reducing the risk of severe disease and hospitalization. And you know, it's for me time to pivot from testing every asymptomatic person in the community, which isn't really leading to very much. We've got a very vaccinated population. We've got a high degree of protection against severe disease, and shift entirely to focusing on how many patients are being admitted to hospital because they are sick with COVID. And that's a very different number. And if you look at that, it's also a much less alarming number. If we look internationally, this strain Omicron is significantly, everything we're seeing from every other jurisdiction is less severe. than the others. And there are a variety of reasons why this may be. But what we're clearly seeing, countries with high vaccination rates, countries with low vaccination rates, that it's simply not as severe. It is much more of, well, you've seen the headlines saying, how do you know if you've got a cold or if you've got Omicron? The fact that you're even asking that question, whether you've got a cold or an Omicron, tells us that it's pretty mild. And so for the vulnerable adults who are always at risk of severe disease, I think the vaccinations have made a dramatic difference in reducing the risk of being hospitalized. And that is a very important message all along. The single most important and powerful thing that the vaccines have provided is that reduction of severe disease in hospitalization and the risk of dying from COVID. And this, again, is an important message because I don't think some of us, vaccines don't make a virus go away. They stop severe disease. And I think that's the message and the balance that we have to try to achieve in our communication. Is going to benefit by far and away the most from a booster are those who are vulnerable already. So our seniors, people in congregate care settings, people with a lot of comorbidities, that group for sure is going to benefit. And the additional benefit from a booster for low-risk people, that's probably an individual decision on how risk-averse a person is. We've certainly made them available for anybody who would like to have a booster.
ਉਧਰ ਅਮਰੀਕਾ ਨੇ ਕੋਰੋਨਾ ਵਾਇਰਸ ਨਾਲ ਸੰਕਰਮਿਤ ਪਾਏ ਗਏ ਮਰੀਜ਼ਾਂ ਲਈ ਆਈਸੋਲੇਸ਼ਨ ਦੀ ਮਿਆਦ 10 ਦਿਨਾਂ ਤੋਂ ਘਟਾ ਕੇ 5 ਦਿਨ ਕਰ ਦਿੱਤੀ ਹੈ ਤੇ ਉਹਨਾਂ ਦੇ ਨਜ਼ਦੀਕੀ ਸੰਪਰਕ ਵਿੱਚ ਰਹਿਣ ਵਾਲੇ ਲੋਕਾਂ ਲਈ ਆਈਸੋਲੇਸ਼ਨ ਦੀ ਮਿਆਦ ਵੀ ਘਟਾ ਦਿੱਤੀ ਹੈ। ਦੇਸ਼ ਦੇ ਰੋਗ ਨਿਯੰਤਰਣ ਤੇ ਰੋਕਥਾਮ ਕੇਂਦਰਾਂ ਦੇ ਅਧਿਕਾਰੀਆਂ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਇਹ ਦਿਸ਼ਾ ਨਿਰਦੇਸ਼ ਇਸ ਗੱਲ ਦੇ ਵਾਧੇ ਸਬੂਤਾਂ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਦੇ ਹੋਏ ਜਾਰੀ ਕੀਤੇ ਗਏ ਨੇ ਕਿ ਲੱਛਣ ਦਿਖਾਈ ਦੇਣ ਤੋਂ 2 ਦਿਨ ਪਹਿਲਾਂ ਤੇ 3 ਦਿਨ ਬਾਅਦ ਕੋਰੋਨਾ ਵਾਇਰਸ ਜ਼ਿਆਦਾ ਛੂਤਕਾਰੀ ਹੁੰਦਾ ਹੈ।
You have so many people simultaneously testing positive. You want to make sure that, particularly among essential workers, that you get people out there much sooner, and by much I mean cutting it in half, saying that 5 days of isolation, then come out and wear a mask for the rest of the time so you can keep people safe from getting infected from you if you still are infected, but at the same time getting you back to what might be an essential function in society. No, actually, we feel that it is safe to do that. If you look at the chance of getting a transmission in that second half of that 10-day period, it's considerably less than in those first few days. So on balance, if you look at the safety of the public and the need to have society not disrupted, this was a good choice with the companies that we will be making between 200 and 500 million tests per month. So when the president was talking about the first tranche of that is going to be coming out in January, but after that there'll be a continuity of tests at an average of 200 to 500 million a month. No, I have not. There's been no decision made on that, and it is unlikely that you're going to see that happen in the foreseeable future. So people have to be careful. Maybe I should be a little bit more careful. When I say it's under consideration, people take the leap and say, well, it's going to happen tomorrow or the next week. We consider all options when we talk about what we need to do for the public health. Yeah, there's no magic number, Kristen, but when you're dealing with a family gathering in a home where you and the people that are there are vaccinated and boosted, although nothing is 100% risk-free, that's a relatively risk-free situation. What I was saying we should avoid is a New Year's Eve celebration where you have 30 or 40 people and you don't know the vaccine status of many of the people. That's something you really want to stay away from.
ਕੋਰੋਨਾ ਦੇ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਦੇ ਲਗਾਤਾਰ ਵਧ ਰਹੇ ਫੈਲਾਅ ਕਾਰਨ ਕੈਨੇਡਾ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੇ ਕੇਸ ਸੋਮਵਾਰ ਨੂੰ 2 ਮਿਲੀਅਨ ਦੇ ਅੰਕੜੇ ਨੂੰ ਵੀ ਪਾਰ ਕਰ ਗਏ ਨੇ। ਜਨਤਕ ਸਿਹਤ ਅਧਿਕਾਰੀਆਂ ਦਾ ਮੰਨਣਾ ਹੈ ਕਿ ਲਗਾਤਾਰ ਵਧ ਰਹੇ ਕੇਸਾਂ ਦਾ ਪ੍ਰਭਾਵ ਸਿਹਤ ਪ੍ਰਬੰਧਾਂ ਤੇ ਹੈਲਥ ਕੇਅਰ ਵਰਕਰਾਂ ਉੱਤੇ ਵੀ ਵੇਖਣ ਨੂੰ ਮਿਲ ਸਕਦਾ ਹੈ। ਇਹ ਵੀ ਮੰਨਿਆ ਜਾ ਰਿਹਾ ਹੈ ਕਿ ਇਹਨਾਂ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ 2 ਮਿਲੀਅਨ ਤੋਂ ਜ਼ਿਆਦਾ ਵੀ ਹੋ ਸਕਦੀ ਹੈ।
Yeah, it's, as you said earlier, an unenviable milestone to reach. And I completely agree. I think the numbers are far higher than what we're actually seeing right now. Because I think everybody, myself included, knows several people personally who have tested positive just based on a rapid test, for instance, and have yet to be able to get a PCR test, which is what gets recorded. So the numbers are definitely higher than they are. And I think it reflects really the fact that there's a lot of COVID that's circulating in all of our communities across the country right now. No, I expect the numbers will be far higher, certainly in terms of the raw case counts and that sort of thing. But what I'm hoping for is that the bump that we see in hospitalizations and of ICU cases doesn't go up as much. And that's yet to be seen. I know there's been a slight increase over the course of the past few days in ICU numbers, but my fingers are crossed, as are all healthcare workers. So from what we can see so far, 10 days is the safest length of time to wait. And where a lot of this chatter is coming from is because of staffing shortages across particularly the United States. And we are seeing that here in Canada as well. But I know the CDC did change some of their guidelines recently, but it does largely reflect the difficulty that healthcare institutions are having with continuing staffing. We're seeing this as well, of course, with airlines canceling flights over the course of the past several days because of people that are isolating. But I do think that it's important that these numbers and the length of time that people have to isolate is reflective of what we can see in terms of transmissibility and not staffing issues, as difficult as that is to reconcile with. It's certainly different for every individual, and I've seen individuals with Omicron confirmed in intensive care even. So it really does have a full range of disease that it can cause. And while I do recognize that it does seem like a lot of the symptoms are, yes, milder than what we were seeing, particularly with Delta, do keep in mind that a mild disease, quote unquote, is just that. You don't need to go into the hospital. You don't need oxygen supplementation. So the definition of mild is more of a medical definition than rather kind of a personal definition. So don't discount it yet. And also keep in mind that even if we have fewer people that need hospitalization, with the numbers that we're seeing right now, that can still amount to quite a problem for the healthcare system.
इस साल जलवायु तब्दीली ने कनेडा ਦੇ ਲੋਕਾਂ ਦਾ ਜਨ ਜੀਵਨ ਬਹੁਤ ਜ਼ਿਆਦਾ ਪ੍ਰਭਾਵਿਤ ਕੀਤਾ ਹੈ। ਇਸ ਸਾਲ ਗਰਮੀ ਦੇ ਮੌਸਮ ਵਿੱਚ ਜਿੱਥੇ ਕੈਨੇਡਾ ਵਿੱਚ ਇੰਨੀ ਜ਼ਿਆਦਾ ਗਰਮੀ ਪਈ ਕਿ ਪਾਰਾ 108 ਡਿਗਰੀ ਫਾਰਨਹਾਈਟ ਨੂੰ ਪਾਰ ਕਰ ਗਿਆ ਸੀ ਤੇ ਸਮੁੰਦਰ ਦਾ ਪਾਣੀ ਤੇਜ਼ ਗਰਮ ਹੋਣ ਕਾਰਨ ਕਰੋੜਾਂ ਸਮੁੰਦਰੀ ਜੀਵ ਮਾਰੇ ਗਏ ਸਨ। ਉੱਥੇ ਹੁਣ ਕੈਨੇਡਾ ਵਿੱਚ ਸਰਦੀ ਦਾ ਮੌਸਮ ਵੀ ਜਾਨਲੇਵਾ ਬਣ ਚੁੱਕਾ ਹੈ। ਕੈਨੇਡਾ ਵਿੱਚ ਇੰਨੀ ਦਿਨੀ ਪਾਰਾ 0 ਤੋਂ 50 ਡਿਗਰੀ ਹੇਠਾਂ ਜਾ ਚੁੱਕਾ ਹੈ, ਜਿਸ ਨਾਲ ਲੋਕਾਂ ਦਾ ਘਰੋਂ ਬਾਹਰ ਨਿਕਲਣਾ ਮੁਸ਼ਕਿਲ ਹੋ ਗਿਆ ਹੈ। ਇਸ ਸਮੇਂ ਕੈਨੇਡਾ ਦੇ ਜ਼ਿਆਦਾਤਰ ਇਲਾਕਿਆਂ ਵਿੱਚ ਪਾਰਾ 0 ਤੋਂ 50 ਡਿਗਰੀ ਸੈਲਸੀਅਸ ਹੇਠਾਂ ਪਹੁੰਚ ਚੁੱਕਾ ਹੈ। ਉੱਥੇ ਹੀ ਕੈਨੇਡਾ ਦੇ ਮੌਸਮ ਵਿਭਾਗ ਨੇ ਜ਼ਿਆਦਾ ਠੰਡ ਦੀ ਚੇਤਾਵਨੀ ਜਾਰੀ ਕੀਤੀ ਹੈ ਤੇ ਆਉਣ ਵਾਲੇ ਦਿਨਾਂ ਵਿੱਚ ਤਾਪਮਾਨ 0 ਤੋਂ -40 ਤੋਂ -50 ਡਿਗਰੀ ਸੈਲਸੀਅਸ ਹੇਠਾਂ ਰਹਿਣ ਦਾ ਅਨੁਮਾਨ ਵੀ ਹੈ।
It is absolutely brutally cold. The whole province is under an extreme cold warning, and you rarely see that. Arctic air, it just swept down across the province, grabbed a hold of the province, and just won't let go. It was -41, an all-time record for that day. And the wind chill, I'm not even embellishing this with a wind chill. I could make it even worse. It was -51. I mean, this is just almost inhumane. This is the kind of weather you get maybe in the dead of winter. I looked at Pincher Creek, one of the warmest spots in Alberta, and it was colder than the North Pole. I mean, come on. I mean, it's like the world is upside down. In Calgary, in 140 years, there's only 1 year that didn't have a January thaw. So I think it's in the cards, like death and taxes and a January thaw.
The extreme cold has visited us a little earlier this year.
Our staff and volunteers are disappointed, of course, but as always, people safety and animal safety is a key priority for us. Everything that we do revenue-wise contributes to animal conservation locally and globally. But we have felt the love and support and encouragement for our community all year.
Especially with school being out, increased private lessons and different kind of offerings, including daytime tubing. So all of that has had to be shut down. This year too, with the COVID challenges, it feels extra unfortunate to not have outdoor activities being accessible due to the weather, because obviously, the more we can get outside and enjoy the sunshine and fresh air rather than being cooped up indoors, the better.
ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਦੁਆਰਾ ਲਿਆਂਦੀਆਂ ਗਈਆਂ ਸਾਰੀਆਂ ਚੁਣੌਤੀਆਂ ਵਿੱਚੋਂ ਯਾਤਰਾ ਬਹੁਤ ਸਾਰੇ ਲੋਕਾਂ ਲਈ ਸਭ ਤੋਂ ਉੱਪਰ ਸੀ। ਇਸ ਸਾਲ ਸੰਯੁਕਤ ਰਾਜ ਦੇ ਨਾਲ ਸਰਹੱਦ ਦੇ ਮੁੜ ਖੁੱਲਣ ਤੇ ਯਾਤਰਾ ਨਾਲ ਸੰਬੰਧਿਤ ਨਿਯਮਾਂ ਨੂੰ ਨਰਮ ਕੀਤੇ ਜਾਣ ਤੋਂ ਬਾਅਦ ਬਹੁਤ ਸਾਰੇ ਕੈਨੇਡੀਅਨਜ਼ ਦੁਬਾਰਾ ਯਾਤਰਾ ਉੱਤੇ ਜਾਣ ਲਈ ਬੇਤਾਬ ਨੇ। ਪਰ ਇੱਕ ਸਵਾਲ ਇਹ ਵੀ ਉੱਠਦਾ ਹੈ ਕਿ ਅਜਿਹੇ ਮਾਹੌਲ ਵਿੱਚ ਬਿਨਾਂ ਜ਼ਰੂਰਤ ਤੋਂ ਟਰੈਵਲ ਕਰਨਾ सही फैसला है।
I've done everything I'm supposed to do, and I want to start living my life. I don't have that many more years.
First of all, do you really need to go? If you don't need to go, then defer. Defer until these areas of hotspots go down.
I'm kind of confused because there's a lot of things that you have to do. Things change on a daily basis.
If it were up to me, I would actually institute finger prick tests, antibody tests. In other words, instead of showing me a piece of paper, show me the antibodies in your blood.
People have been faking documents and identifying that they are vaccinated when in fact they're not.
It's been devastating. Tourism's right up there with oxygen for us here in Niagara Falls. We get 14 million people here a year. Typically 25% of them come from the US and they represent 50% of the revenue. So this is huge for tourism.
Strip in.
What do you think?
Thrilled. Happy to be here.
Yeah.
We come once a year. We haven't been in 2.
The border was open before. I would have been down there already.
It's the most exciting day we've had in a long time.
To have the Canadians back is going to be really exciting.
Canadian visitors can make up to 20 to 25% of our visitors for the winter. We really miss them. We miss their culture. We miss their all the families that come.
ਪਾਕਿਸਤਾਨ ਦੇ ਸਾਬਕਾ ਐਮਪੀ ਤੇ 10ਮ ਪਾਤਸ਼ਾਹ ਸ਼੍ਰੀ ਗੁਰੂ ਗੋਬਿੰਦ ਸਿੰਘ ਜੀ ਦੀ ਬਖਸ਼ੀਸ਼ ਪਵਿੱਤਰ ਗੰਗਾ ਸਾਗਰ ਦੀ ਸੇਵਾ ਸੰਭਾਲ ਦੀ ਜ਼ਿੰਮੇਵਾਰੀ ਸੰਭਾਲ ਕਰ ਰਹੇ ਰਾਏ ਕਲਾਂ ਦੇ ਵੰਸ਼ਜ ਰਾਏ ਅਜ਼ੀਜ਼ ਉल्ला ਖਾਨ ਨੇ 10ਮ ਪਿਤਾ ਦੇ ਛੋਟੇ ਸਾਹਿਬਜ਼ਾਦਿਆਂ ਬਾਬਾ ਜ਼ੋਰਾਵਰ ਸਿੰਘ ਅਤੇ ਬਾਬਾ ਫਤਿਹ ਸਿੰਘ ਜੀ ਦੀ ਅਦੁੱਤੀ ਸ਼ਹਾਦਤ ਨੂੰ ਯਾਦ ਕਰਦਿਆਂ ਅਤੇ ਸਿਜਦਾ ਕਰਦਿਆਂ ਉਹਨਾਂ ਨੂੰ ਸ਼ਰਧਾ ਦੇ ਫੁੱਲ ਭੇਂਟ ਕੀਤੇ। ਆਪਣੇ ਸੰਦੇਸ਼ ਦੌਰਾਨ ਰਾਏ ਅਜ਼ੀਜ਼ ਉल्ला ਖਾਨ ਨੇ ਇਹ ਵੀ ਕਿਹਾ ਕਿ ਗੁਰੂ ਸਾਹਿਬ ਅਤੇ ਉਹਨਾਂ ਦੇ ਪਰਿਵਾਰ ਵੱਲੋਂ ਮਜ਼ਲੂਮਾਂ ਦੀ ਰੱਖਿਆ ਲਈ ਕੀਤੀਆਂ ਕੁਰਬਾਨੀਆਂ ਨੂੰ ਕਦੇ ਵੀ ਭੁਲਾਇਆ ਨਹੀਂ ਜਾ ਸਕੇਗਾ। ਉਹਨਾਂ ਅੱਗੇ ਵੀ ਕਿਹਾ ਕਿ ਗੁਰੂ ਗੋਬਿੰਦ ਸਿੰਘ ਜੀ, ਮਾਤਾ ਗੁਜਰੀ ਜੀ ਅਤੇ 4 ਸਾਹਿਬਜ਼ਾਦਿਆਂ ਦੀ ਕੁਰਬਾਨੀ ਸਾਨੂੰ ਹੱਕ, ਸੱਚ ਤੇ ਇਨਸਾਫ ਦੀ ਜੰਗ ਲੜਨ ਦੀ ਪ੍ਰੇਰਣਾ ਦਿੰਦੀ ਹੈ। ਉਹਨਾਂ ਅੱਗੇ ਵੀ ਕਿਹਾ ਕਿ ਉਹਨਾਂ ਨੂੰ ਇਸ ਗੱਲ ਤੇ ਮਾਣ ਹੈ ਕਿ ਗੁਰੂ ਸਾਹਿਬ ਜੀ ਦੀ ਬਖਸ਼ੀਸ਼ ਪਵਿੱਤਰ ਗੰਗਾ ਸਾਗਰ ਦੀ ਸੇਵਾ ਸੰਭਾਲ ਕਰਨ ਦਾ ਮਾਣ ਉਹਨਾਂ ਦੇ ਪਰਿਵਾਰ ਨੂੰ ਹਾਸਲ ਹੋਇਆ ਹੈ। ਫਿਲਹਾਲ ਵਰਲਡ ਪੰਜਾਬੀ ਨਿਊਜ਼ ਵਿੱਚ ਇੰਨਾ ਹੀ। ਹੋਰ ਤਾਜ਼ਾ ਖਬਰਾਂ ਲਈ ਤੁਸੀਂ ਵੇਖਦੇ ਰਹੋ ਚੜ੍ਹਦੀ ਕਲਾ ਟਾਈਮ ਟੀਵੀ। ਮੈਨੂੰ ਦਿਓ ਆਗਿਆ। ਧੰਨਵਾਦ।